I think we should start for all of you on-time people who are here bright and early on a Monday morning. Welcome to Population Reference Bureau. Welcome to the IGWG GBV Task Force. We are very pleased to see all of you, and I would like to remind you, as though you need any reminding, that this is International Women's Day week, and we're very excited about this because the theme is Be Bold for Change, and I think that's what we're all going for here. We're hoping to change the circumstances of women worldwide, girls and women, and so our topic is very timely for this week, for any week really. Let me first just introduce myself. I'm Charlotte Feldman-Jacobs. I'm Program Director for Gender at PRB and Deputy on the PACE project. And we have here two of our gender advisors from USAID's PRH office, Michal Avni, whom most of you already know, and Afifa Abdul-Rahman. And we have Jeff Jordan, PRB's president here. So we're happy that you all could be here. We have on the line Rose Wilcher, who's the co-chair with PRB. She's with FHI 360, and she's in North Carolina. She'll be listening in, hopefully throwing out the first question. That was a surprise to her. I just made that up.
Thanks, Charlotte. Good morning, everyone.
Yeah, there she is. And we have somebody else on the phone that I wanted to mention. We have a research team from Bangladesh that's listening in, and they're doing some really important research there and on this topic, and wanted to hear what we have to say, and hopefully we'll get a chance to hear what they have to say and how these things are being used around the world. The topic today, of course, is child early and forced marriage and intimate partner violence. What do we know and what can we do? We have three amazing speakers, and I'm very grateful to all of them, and I'll be introducing them right before they come up. I think that will be most helpful. But I would like to say that we know more now and will after this morning about what do we know. What can we do is a work in progress, and Jeff will help us move along that line. But any kind of conversation that begins here, we will really hope continues. We'll post all of their PowerPoints on the IGWG website. We invite you to email any of us to give feedback or suggestions how to carry this topic forward. Housekeeping items. Phones on silent, bathrooms, keys in the back, and follow the signs out that door. Nicole Legrone has kindly left you breadcrumbs all the way there and back. There's keys to the bathroom and to get back into this room.
Bit of a labyrinth.
Yeah, it is a labyrinth.
You'll figure it out.
So without further ado, I think we will start with Rachel Kidman, who came in from Long Island this morning. Yesterday afternoon. Rachel is core faculty at Stony Brook University for the Public Health Program and assistant professor in the Department of Family, Population, and Preventive Medicine. Dr. Kidman is a social epidemiologist focused on child and adolescent adversity in sub-Saharan Africa. Her current research explores sexual victimization and HIV risk among orphans, the behavioral risk profiles of perinatal HIV-infected adolescents in South Africa, and the role of adverse childhood experiences in shaping divergent HIV risk trajectories during adolescence in Malawi. And of course, all of this shapes adulthood and the rest of adolescence. Other areas of interest include policy determinants of health for vulnerable adolescents. That's relevant, including the potential of national policies to reduce child marriage globally, and impact evaluations of community-based programs. So the format for today, we'll ask Rachel to present. We'll have about 10 or 15 minutes for clarifying questions. Then we'll move to our second and third presenters with room for clarification after each. And then we allow plenty of time for discussion and questions and suggestions generally. So Rachel, please.
Thank you very much for having me. I'm really excited to speak to this audience today. Can you all hear me? No. Yeah, can you turn it up? All right, thank you. Much better. So as Charlotte mentioned, I'm going to talk about the big picture to kick this off, using global data first to look at child marriage and intimate partner violence, and then to link it to some legal protections and talk about whether those work. So to start with, I'm going to be talking about child and early marriage and using the term somewhat interchangeably, though there's some nuanced differences. And when I speak about child or early marriage, I'm talking about marriage before the age of 18, which is the legal definition of a child embodied in most international conventions. And about 1 in 3 women in low and middle income countries today were married before the age of 18. 1 in 3 is about the same number who will experience intimate partner violence, or IPV, across their lifetime. Child marriage is highest in South Asia. It's also very high in sub-Saharan Africa, though we know less about it in that region, arguably. And it's a current problem. About 40,000 girls every day are married before age 18. So it's a pervasive human rights violation that is ongoing. And it has many adverse consequences for their social, educational, and health outcomes. And in health in particular, child and early marriage has been linked to higher rates of unintended pregnancy, of maternal mortality, particularly for the youngest brides, so those under 15. It's linked to adverse outcomes for their children and to higher rates of STDs, including HIV. There is now concern that it may also be a risk factor for intimate partner violence, which is why we're all here today. So there are a number of potential mechanisms by which it may affect intimate partner violence within marriage. Many of these boil down to the same factors that fuel child marriage also tend to fuel intimate partner violence. So the harmful gender norms are fueling both. They are permitting child marriage, and they are also more permissive around violence within the marriage. So, for example, girls may be coming from very traditional families with unequal gender norms. They may see a lot of intimate partner violence within their own families. They may have internalized some of these norms by the time they get married. They're marrying older men who are also coming from very traditional families that are more permissive and accepting of violence within the home. They're also very socially vulnerable girls who are getting married earlier. So child marriage is associated with poverty, with low education. These are girls who are often getting married out of economic necessity. Their parents can't necessarily afford to send them to school. They see early marriage as a way of securing the girls' economic future. And so these risk factors, poverty and lack of education, are risk factors for intimate partner violence as well. So it may just be that the kinds of girls who are getting married have the risk factors for IPV to start with, but it may also be a causal mechanism. It may be that there's something about getting married early that actually places them at risk for greater intimate partner violence. So when they marry early, their education is often curtailed, so they have less education. They are marrying before they've become economically independent or really built up any assets. They haven't really had a chance to establish a social network or social support outside of their family, so they're very socially isolated. Excuse me. And they're entering into marriage with someone who's likely older, who's of a higher social standing, and this sets up a very unequal power dynamic, which can fuel intimate partner violence as well. So there are a number of potential mechanisms, theoretically, whereby child marriage could increase IPV, and there's also empirical evidence building for this relationship. So there are a number of strong studies out of South Asia that support a relationship between child marriage, excuse me, and greater physical intimate partner violence specifically. The studies around sexual violence are much more mixed. I think out of South Asia there are several studies. Only one of them has actually shown a relationship, thank you, Charlotte, between intimate child marriage and sexual violence within a marriage. There are also very few studies outside of South Asia. They're building, there are small studies, but they also present a very mixed picture. And so my goal in looking at this, this relationship was really to start broadening our geographic view of this relationship and coming up with some more comparable, robust findings. And so the study aim was really to look at whether women who enter into child marriages are at increased risk of physical or sexual intimate partner violence. And I use demographic and health surveys, nationally representative surveys from low and middle income countries, which you are all probably intimately familiar with, I'm sure. But I use the most current survey from 34 countries. And I use surveys that collected the domestic violence data. So the domestic violence module was an optional module that was added to the surveys in the late 1990s. And the importance of this is that there are comparable standardized measures for intimate partner violence that we can use to do cross-national comparison. So I focus on women who are 20 to 24 to really capture the contemporary relationship between child marriage and IPV. And I have about 60,000 women from 34 countries who completed the domestic violence module in that age group. I'm looking at the impact of child marriage, and because very early marriages, which I define as before 15, can have even more profound impacts on health and other well-being indicators, I separate that from marriages that happen in later adolescence, so 15 to 17. And then I'm looking at past year physical and or sexual violence. In the domestic violence module, excuse me, the domestic violence module is based on a modified conflict tactics scale, and it tries to ask very specific questions about acts of violence. So it tries to leave less open to interpretation. And so the questions around physical violence are things like, has your partner ever pushed or shoved you? Have they kicked you? Have they hit you with their fist? Have they tried to strangle or burn you? Have they pulled your hair? Very specific questions. And so if they answer yes to any of those in the past year, they are considered in my study to have been a victim of physical violence. There are only 2 questions on sexual violence, and those are a little bit more open to interpretation. And those are whether the partner ever physically forced the respondent to have sex when she did not want to, and whether he ever forced her to have any other sexual acts, perform any other acts when she didn't want to. But of course, it's a little more subjective because you have to think about when she didn't want to. And about a third of our sample, experienced child marriage, and about a third of the sample here experienced past year intimate partner violence, primarily physical violence. And then lastly, we use logistic regression models where we pool all the data from those countries and look at the relationship between child marriage and intimate partner violence. And then I'll break it down by region and by country. So this is just the raw descriptives. And as you can see, physical violence is much higher for those girls who married under 15. It's much higher for those who married between 15 and 17 compared to girls who married as adults. This sample right here is all women who aren't currently married. There's also an elevated risk of sexual violence, and when we combine the two, we see, of course, the same pattern. So if there's one visual you take away from this presentation today, let it be this one. I'm going to show a bunch of numbers after this from, fancier models. They all serve to confirm this relationship. So no matter how we cut it, it seems that girls are at increased risk for physical and sexual violence in their marriages if they have married at an early age. So specifically, these are the multi-level models. On the left, we have the unadjusted models. On the right, I have models that are adjusting for some very basic demographics, wealth, age, primary education, a few other things. But as you can see, there's a very robust relationship between early marriage, very early right here, and early between 15 and 17 here, and intimate partner physical violence. So about a 60% increased odds. It goes down just a little bit when we adjust for some of these other factors, but it's still very robust and strong. This is the outcome for past year's sexual violence. It's also very robust. It's slightly weaker in magnitude. This might be a real difference. It could be that child marriage has a slightly less strong impact on sexual violence compared to physical violence. It could also be reporting error. So those questions, remember, about sexual violence, there were fewer of them. They're a little bit more subjective, and girls who have entered into child marriage may also have views about how they respond to sexual advances from their husbands that don't see most of that as forced, even though it's unwanted, really. So this may be an artifact of how we collect the data. It may also be a real difference, and I can't really tell that with the data we have at hand. And then this, of course, again, is just the combination of these two. It's physical and or sexual. And just to simplify the rest of the presentation, I'm going to concentrate on that combined measure. So when we look at it by region, and I cut the 34 countries into region, we still see a very strong and consistent pattern, but we do see some elevation of risk in East Asia and the Pacific. We see slightly less risk in Sub-Saharan Africa. We then cut it down by country, and we see even greater variability. So I'm not sure if you guys can actually see over the chairs, but for physical violence, physical and sexual violence, being married before age 15, very few countries showed a robust relationship there. That's partly because there are certain countries where marriages below 15 are really uncommon. So we have very few girls getting married under 15. It's very hard then to show a statistically significant relationship. So the bigger finding, and the place I'd like you to focus, is that 19 out of 34 countries showed a robust relationship between early marriage and intimate partner violence. But that means that over a third of the countries do not show a relationship. And this is really important heterogeneity. It's important variability because we can learn from it. What is it about the countries that don't show a relationship that is protective for child brides? And I don't have that answer, particularly not from this level of data. But I think it's interesting to think about, is it because the motivations are different? It's an economic motivation versus a cultural motivation? Or is it something about the society that is more protective of child brides? So if anyone wants to investigate that further, I think it would be ripe for lessons on how we could possibly intervene and create a more enabling environment. So lastly, I looked at whether the disadvantage persisted into adulthood. I looked at this originally with age 20 to 24, but then I went up in 5-year intervals to see if the relationship persisted as these women got older. And I still see a strong relationship. It's of lower magnitude, but it's statistically significant. It persists. It's consistent, which means even as these girls are in the marriages longer and longer, acquire other resources, they're still at a disadvantage 20 years on, because they were married as children. So from this part of the presentation, the take-home is really that women who marry as children, so women who are marrying before 18, are much more likely to experience physical or sexual violence. We don't know a lot about what works to combat child marriage. We're certainly learning. We're on the learning curve there. I think there are a number of strategies that are promising, including I'm going to talk about the implementation and enforcement of laws. We know we need to change norms and values. We don't know quite how to do that most effectively. We know we need to expand educational opportunities and economic opportunities. Again, there's a lot of evidence there, but we're still learning how to do this on a large scale effectively. And more relevant to this, we need to know how to protect those who marry early. You know, no matter what we do on number 1, we're still going to have thousands of girls every day getting married very early. So what do we do to protect those girls? And many of these interventions may be relevant at both levels. So changing norms, changing economic opportunities for girls who are in early marriages. But I think we have much less evidence on that level. So I know the panelists today are going to focus more on how to protect them at the community and programmatic level. So I want to take just a moment, the last couple minutes, to talk about legislative frameworks and approaches. So specifically, I'm going to talk about national marriage laws. You know, most international conventions starting in the 1960s, and certainly including the 1979 Convention on the Elimination of All Forms of Discrimination Against Women, call for a minimum age of marriage to be established. And most recently, they've called for that minimum age to be 18. This is viewed as an essential first step, but these laws are in place in many, many countries around the world, and we really haven't seen vast declines, which begs the question. We're putting a lot of emphasis on these laws. Are they having any impact? And so that's what I was curious about. I just want to set the landscape for a moment. This is the minimum legal age of marriage for girls as of a few years ago, all over the world. And this is actually sort of a nice picture. Looks like we're doing a really good job. We see a lot of blue. Almost every country set 18. But before we pat ourselves on the back, this is the map when we take parental exceptions into account. And since child marriage is mostly a decision made by the parents, this is de facto really the age of marriage that's legislated. All right, and you can see we're in yellow, so we allow marriage between 14 and 15, but many other countries do as well. All right, and it gets worse. So this is the legal minimum when all exceptions are taken into account. So these are exceptions like religious exceptions, customary law, a judge allows you to marry early, you've been raped and therefore you can get married, you're pregnant, so therefore you can get married. So this is not particularly protective. I mean, there's no minimum in most countries. You see a lot of red here. So are these legislative actions having any impact? That was the question before me and that I wanted to answer. And we have this wonderful demographic and health survey data from all over the world that we can use to quantify child marriage and look at individual outcomes. And then there's a World and Match Equity database where they collected policy data dating back to 1995 on child marriage legislation from primary country legislation, UN reports, and many other sources. Okay, can you, thank you. All right. I'm going to keep talking as she does that. So to answer a causal question about legislation and its impact, we need longitudinal data. So I looked at countries that had repeat observations in the DHS. So we had a number of observations on any given country over time. We have this lovely longitudinal data on the policy and the legal age of marriage. I focus on the legal age with parental exceptions here. So we have really good comparable data at both levels that can be linked. I again focus on that young age group, 20 to 24. I have about 100,000 women from 22 countries where the country did not have a protective policy in place at the beginning. So I looked at countries that allowed early marriage at the beginning. And I followed them over time, and out of those 22, 6 of them, sometime over my study period, enacted stronger legislation that banned child marriage before 18 with parent permission. So I'm basically comparing the trajectory of these countries that enacted new legislation to countries that did not change their lax policies. And what we would expect is that countries that had no legislation in place would be going along and they'd put that legislation in place, and then either immediately or maybe a year or two later, we'd start seeing a decline in child marriage. This is what we want to see if the legislation is working. And again, I'm looking at individual data. I'm actually assigning, based on the girl's birth year, her exposure to marriage policies when she was younger. And I'm using a bunch of sort of fancy analyses to look at this. Multinomial just means them looking at 2 outcomes at once. In this case, very early marriage, before 15, and early marriage, 15 to 17, and fixed effects models, which means I'm looking at the trends within countries and comparing them essentially. And again, it's really just the visual you need to take away. I'll show you the models in a second, but let me explain this visual. So this is the prevalence of marriage before 15. This is the prevalence before 18. The black line is the prevalence over time in all 22 countries. So it wavers a little bit, maybe even going up a little at the end. And again, this black line, the prevalence overall in all the countries, the comparison countries. The green line is this one specific country that changed its policy, and it changed it in 2004. What we would hope to see is immediately or just after a decrease in child marriage rates. We don't really see that here. So I haven't put all the countries up here just for time, but I put a couple more up. So here's Ethiopia and here's Nigeria. Maybe there's a hint of a decrease in Ethiopia, but certainly not in Nigeria. So we're not seeing much of an impact at this very raw level. And you can argue with these raw descriptives all you want. If people want to see fancy numbers, we can do we can do multinomial fixed effects models. We can do these sort of fancy models that take into account a number of different things, but the end result is the same. You know, whether you look at it visually or whether you do everything with sensitivity analyses, you come up with the conclusion that the relative risk ratio is about 1. No, nothing, nada. So we're not really seeing much of an impact. Somebody argued, well, maybe it has an impact in some countries and not others. So I broke it down by the countries that changed their policy. And again, you really don't see anything. Maybe there's a decrease in Sierra Leone for one age group, but this isn't really compelling evidence that the policies are having an impact. So again, the take home for me here is that these are essential laws. You know, I don't want to negate their value in any way, but they're not enough. The passage of a law doesn't really influence practice in the country unless you take further steps. And right now, international bodies are really good at monitoring whether or not these laws are in place, but they're not monitoring whether they're implemented and enforced. So, you know, is there community awareness programs for the age of marriage? Is there any sort of marriage registry set up so we can actually track who's getting married early, for that matter, birth registries, so we know how old they are? Is there any sort of enforcement, any penalty, criminal penalty for these? And in most cases, you find there really aren't when there are case studies. But this data is not collected systematically the same way some of the policy data is. And I think it's really essential. So we can really only realize our potential if we start collecting that data and actually holding countries accountable for the implementation and enforcement of laws. And then the last thing, I didn't show you in these models the association between some of the socio-demographic variables in these child outcome measures, but education and poverty really pop in every case and are so much more important and robust predictors. And I know we'll talk about it at the program level, but I also want to emphasize that this is something that can be addressed at the national sort of policy level in terms of tuition-free compulsory secondary education, in particular for girls, cash transfers or other sort of social transfers. And so when we're talking at a policy level about child marriage, it's not just laws about child marriage and the minimum age. It's laws about social protection much more generally. And I'm going to end there and take some questions, and then I'm really excited to hear from the next two speakers who will bring this down a notch to really look at what's happening at the country level and at the programming level. Thank you.
Thanks so much, Rachel. I'm going to take the clarifying questions now. We have about 15 minutes for those, and then we'll take more discussion at the end, hopefully lots of discussion at the end, but that was amazing, and as a policy advocacy group, so welcome. So thank you. I also wanted to say that we have, I have a few copies of Rachel's journal article, Child Marriage and IPV, a comparative study of 34 countries. So if you want to come and see me, and we'll also upload the link to the IGWG with the presentations, and hopefully you all know people who can get into those journal articles for free.
Or just email me.
Yes, so we have so many people in the room who are deep, deep, deep into this. So Rose, I'm gonna take the room first, and I'll turn to you. Questions, Jeff?
Jeff, just a question: as you try to look at implementation, the bank and others do some national or global indices that look at governance.
Yeah.
Have you run any, or have you looked at that as a way to look at who scores well on implementation of policy and see if there's any cross linkages to say, you know, what's happening in terms of countries? Again, to get back at this question of implementation versus and judicial follow-up versus just the existence of policy.
That's a great point, and we did consider that. This study actually has also some other national level indicators that were integrated from the World Development Indices to try and capture some country level indicators of gender inequality and parliamentary participation by women and whatnot. We did not or could not look at governance really as a modifier because we only have 6 countries that changed their policy. You know, we have 100,000 women, but unfortunately, the unit that matters for analysis is that higher level unit of 22 countries. And we only have 6 changing, and you know, 16 that stayed the same. It's a very small sample size, and I spent a lot of time on this study trying to think of inventive ways to look at all of this, and we just don't have the data. It's very hard to even do the policy, you know, analysis and make it robust, and I think it's very much still open for, you know, critique. And I have my own questions even about that given the sample size. But I think that that's that would be a wonderful way to move forward if we could gather a bit more information. What we did is instead look at some of the case studies and look at what might be holding it up. And, you know, in India, for example, I think there were, in 1 year, there were maybe 8 prosecutions for child marriage, which is sort of a sign that maybe we're not enforcing it. I mean, I think that was one district, to be fair, but still. And in Ethiopia, I had a colleague who looked at the laws, and while there's a national law, marriage is actually governed at the state level. And so the national law doesn't really mean anything, and we have seen states adopt that over time, which might be why we're seeing a slight decline in child marriage in Ethiopia. But I can't really, you know, link it to that one point where we've had either the implementation of the law that year, or I've tried some lagged models as well. So I would love to be able to, and I just can't.
Can I give the next question to Carrie McQuarrie of DHS, who's done a lot of work on it?
This actually might be bridging between a clarifying question and a substantive one, so if you want to defer your answer. I was just curious, in the first study that you presented, your decision not to examine emotional violence, since emotional violence is sometimes as prevalent or even more prevalent than the physical violence,
yeah,
and the measures are measured in the same time-bound way.
Good question. Were you my third reviewer? Yeah, so I didn't do it originally just because when I merged all the data, I was actually, I did the second paper first. And when I went to do the lit review, I realized that I wanted to quote the fact that there was, you know, this relationship, and I could only really find strong evidence in Asia. And and I said, well, I have all this data. I'm going to run this and just see out of curiosity. And I said, well, I guess I should write this up for somebody. So I went at it a little bit backwards, which is part of it. And I hadn't actually just pulled in the emotional data. And I almost did at the last minute, but the paper got out of control with all of the different levels of physical and sexual and, you know, global and regional and country, and it just got so big that I went back and forth with the editor trying to decide whether we should also incorporate that. But I completely agree. Some of the evidence for other outcomes shows that emotional is actually more important. So I think, you know, it's something that anybody else wants to run, I'm happy to run with you, but I haven't done it yet.
The next paper. I just also wanted to add that I've done some analyses of the way that the different items compare cross-nationally, and there are only 2 sexual violence items, but they hang together as one factor consistently in about 18 sub-Saharan African countries where I ran those analyses. So there's a little bit of reliability there in terms of that as a form of violence.
Yeah, I think they're reliable between each other. I just don't know that they are answered the same way by people, country to country, but also by people who hold different views of marital relationships and responsibilities. So I'm just not quite ready to say that the slightly weaker association is real and not a difference in measurement. So thank you for doing all the DHS work that I leverage for all of these things. I think, the inclusion of this domestic violence module was really important and allows us to do some of this work. Because before we said, oh, there's some differences between studies, but maybe it's just how they measured it or defined it. The fact that we have these measures that we can use country to country is so critical for this work. Question?
Hi, I'm Kate Gillis with PRB and Population Council. This was fantastic. Thank you for doing this, and I share Charlotte's appreciation for policy advocacy perspective. I had two questions. The first is, are there any countries? Did you identify any countries that introduced social policies, around education or something, or something along those lines, but either had already had existing laws or didn't change the law? And then the second is there, what kind of concerns are there that enforcing the laws without addressing the norms in some way is just going to result in driving the practice a little bit more underground and potentially making those girls more vulnerable?
Thank you. Those are great questions. And unfortunately, I can't really speak to the second. I think it's a concern and something that would need to be monitored, certainly. For the first, again, when we set out to do this, we said, okay, we're going to look at the influence of the marital age policies, then we're going to look at the clustering of policies. Do countries that have a suite of protective policies, social protection, education, child marriage, do those countries do better? Do you need all of those in place? And again, it boils down to not having the sample size to do that. There's a colleague, I believe she's a postdoc right now at UCLA, who I think was looking at the education and social protection laws specifically and their impact individually on child marriage, and I don't think she's yet published that work, and I don't have the findings with me. I believe they were not as robust as we would have hoped. But other people are looking at that. The policy comes from the World Policy Analysis Center at UCLA, which is run by Jody Hyman. And if you haven't been on their website, they have fabulous maps and data, and you can really see what is available and what you might want to pull and look at.
Any other questions? We have time for one more. Otherwise, we'll go to the next speaker, and you can hold on. Here we go.
Hi, I'm Kadambari Sridhar from Collective Impact, and I did my MPH at Stony Brook, and my advisor was your predecessor, actually. So, my question is about migration because especially at the time you're looking at, in the past, say 20 to 25 years, there's been consistent migration between, say, South Asian countries to the West, say Europe and America. And I don't know if some of these cultural attitudes show up in your data based on the population you're looking at. And particularly now with refugee situations, I think early marriage is something that we could think about as a way in which women are being sold into richer households as a way for them to escape displacement. All great questions. I mean, everybody has fabulous questions, and I wish I could answer them all. But the DHS is in low and middle income countries. It doesn't really capture what's happening when they get to somewhere like the US or Europe. I do certainly think that's a concern just from a layperson's perspective of reading the newspaper articles on Syrian refugees these days and what's happening. So I echo that concern, but I don't have data to speak on that. I think that'd be a great topic of research for somebody. Happy to collaborate.
I think we'll take one more clarifying question in the room, and then I'll ask the people online.
Okay. Hello, my name is Liliana Bebe. I'm with the Rest of Our Life. It's a non-profit organization, domestic violence education. Mine is not actually a question, it's a contribution to when you said that it's not enough to have the laws in place, but about changing the atmosphere. I'm originally from Nigeria, and as you can see, we do have situations of early child marriage. I'm actually surprised. I was surprised to see that we have a policy that says that you should marry when you're under the age of 18. But we have that. But one of the things that I say is awareness, because a lot of people who A, don't know, and B, one of the things I found out recently is actually confusion of factors. So we had an emir the emir of Zaria, who married somebody who was 18. Fine. And this is somebody who was the former governor of the central bank, so somebody who's very educated, and you wouldn't expect that to happen. Now, when the country is sort of divided and people saying this should be done and this shouldn't be done, some people were saying about people on the south who marry, because of poverty, I guess, and things like that, but people who might be 25 years old and marry somebody who's 60 because the person is wealthy. But that's not the same thing as early child marriage. And so that was the argument that was being used to endorse what the emir had done. And I saw that as a new trend, that sort of people are not able to distinguish, what is early child marriage and what is somebody who's just marrying for money. So some of those dynamics are definitely things that are going to come into play.
Thank you.
Do we have anybody online who has a question? Rose, do you have a question yet?
Well, I do, but I was going to save it for the discussion.
Great, great. Okay, thank you so much, Rachel. That was amazing. So our next speaker is Dr. Sanyukta Mathur, and her topic is experience of violence and association with HIV risk among young women, including young married women in Kenya, the DREAMS Initiative. Dr. Mathur is a behavioral and social scientist and a researcher with the Population Council HIV and AIDS program. Her research focuses on the intersection of social norms, gender, and empowerment, livelihoods, and social transitions on reproductive health and HIV/AIDS outcomes in sub-Saharan Africa and South Asia. She currently serves as the project director for the Council's DREAMS Implementation Science Research Portfolio. She's also an adjunct assistant professor at Columbia University Mailman School of Public Health. And I have to say that Sanyukta and I both were overlapping at International Center for Research on Women 15 to 20 years ago when we were in elementary school. Sanyukta, you want to come up? Yeah, I think so.
Great. Good morning, everybody. This is okay? Yeah. Happy to be here, and I think hopefully this will follow really well after Rachel's presentation. So I'm going to, as Charlotte said, I'm going to talk about a particular country context. We're talking about Kenya, and this is within the broader context of the DREAMS initiative that's going on. The Council is currently leading a set of 10 research activities that are related to the DREAMS initiative, and they're focused on 3 large pillars of work around the girl-centered programming, which is the core to the DREAMS initiative, reaching male partners and introducing PrEP. And the study I'm talking about today is really focused on what is the effectiveness of community-based girl-centered programming in Kenya. So our programs recruiting and identifying the most at-risk girls in the context of the DREAMS initiative, it's really at risk for HIV into these programs. Do the engagement in these programs actually reduce their risk? How are programs encouraging girls to get involved in the DREAMS program? Is there fidelity to the program design, and what are the costs per beneficiary of this fairly integrated program? The context for this study is actually, and the way that the DREAMS initiative selected sites is looking at within countries where there was the greatest variability of HIV, and so the highest concentration of HIV, where those locations were selected as DREAMS sites. So Nyanza province is one of those sites, and within Kisumu County, where our study is happening and where the DREAMS implementation science is happening, has some of the highest prevalence in Kenya. This map might be a little tricky to see, but basically the darker purple is the highest prevalence. We're talking about 15% HIV prevalence. So there's a fairly high prevalence region within Kenya that we're working in. And some of the basic sort of DHS stats right here is the median age, reported age at first sex is 16 years. Median age of first marriage is 19, so it's not as low as some of the countries in South Asia that I've worked at, and even some of the data, Rachel, you're presenting. But in line with what you were saying, there is fair bit of regional variability, but median age at first birth is very soon after that. So these things are happening. Once women get married, they're having kids quickly. So DREAMS intervention activities, again, I can talk more about DREAMS, but I'm not really here presenting the DREAMS initiative, so I'm not going into detail about that. But they started in June 2016, and our study is looking at those objectives. We have 3 phases of data collection. Actually, we've just finished the first one, finished it February 28th. So the analysis I'm presenting is like fresh off this data. So it's very, very quick. And you guys are actually the first audiences to hear it, so we'd love some feedback. It's a mixed method design. We're talking to girls, we're talking to implementing partners, we're doing also direct observation of the program activities. So I'm going to talk mostly about the data that we've collected with girls who are engaged in the program. Because DREAMS is looking at a lot of different things, they're trying to address both education, both social norms, HIV knowledge, connection to services. Our survey is actually fairly extensive, and it does include a specific module on experiences of sexual and physical violence. And Carrie, to preempt your question, I think there are a few emotional violence questions, but I did not analyze them for this presentation, but I will be sure to do so. Similar to Rachel, we did also use we adapted questions from the WHO Violence Against Women survey, and we have a set of questions both on physical violence and on sexual violence, more than just the two. But for the ease of this presentation, it was any experience of sexual violence or any experience of physical violence with a current or previous partner in the last 12 months. Just some simple background characteristics, and the data I'll present is really just into 3 pieces. A little bit about what is the experience of violence, a little bit about what is the connection between this experience of violence and HIV risk, and then what we think could be done, more could be done. So the DREAMS program is already doing something, but I think we're finding some things that could be tapped into and how to address this experience of violence. Most of our sample, at least the mean age of the sample, is about 19 years old. Most of the girls are sexually active. In this sample of girls who are engaged in the program, most are actually not married. So this is, when we're looking at this sample of girls who are in the community, that's part of our study design, we're going to look at this. Did the girls that DREAMS is enrolling in this site are actually mostly unmarried girls. And the reason might be this: you have a very high proportion of girls that are actually in school. Kenya is one of the countries that has a secondary schooling program, so it offers free or low-cost secondary schooling. So there has been in the last several years a major push to get girls into school. And in our sites, which are, one of them is a fairly dense urban slum area and one adjoining peri-urban area, there's still a high rate of enrollment, which is both surprising and interesting. Many of the girls say they are working, and then I didn't present this, but most of the girls are not actually working for money. So they're either in school or doing sort of in-kind work. I think those contexts are important to look at when you're looking at what is really opening up girls to early partnerships or partnerships where violence is engaged. Okay. So this is experience of interpersonal, intimate partner violence in the last 12 months. And we find that amongst all girls, about 24% have experienced physical violence and about 19% have experienced sexual violence. So this is just last 12 months, as Rachel was presenting in her analysis. We also have lifetime. It is higher. We then sorted out by married and unmarried, and as you would expect, unfortunately, the experience of violence is higher, much higher among married women. I didn't put little asterisks here, but these are statistically significant differences between the married and unmarried. So we look at, I'm going to present just some basic stuff on how we looked at how this connects to HIV risk. So first we wanted to look at Well, our girls testing for HIV, and testing is very high. Everybody's testing. It's part of the program design, so you would expect that. We looked at what their reported HIV status was at the last test, and about 3% of the sample is HIV positive. And we look at it by marital status, and again, you see that the girls who are married are more likely to be HIV positive. And then we look at likelihood of exposure. So because we don't have a sufficient sample to really look at HIV status per se as an outcome, we looked at likelihood of HIV exposure, which has been shown in other studies to be a fairly good predictor of whether girls are going to acquire HIV. They know, girls understand what their risk is. And we find that 20% of the girls feel like they're very likely or somewhat likely to be exposed to HIV through their partners or through their own behavior, and the rates are higher among married women. The second sort of HIV risk variable we looked at was STI symptoms. And this is, have you experienced an STI symptom in the last 6 months? And we asked about, again, a range of STI symptoms. So everything from itching, painful urination to GUD, so ulcers. And we find about 23% of the girls have experienced STI symptoms. Again, we looked at it by married, unmarried, more likely among married women. They're probably having more sex, so that makes sense. But then we also looked at STI symptoms by experience of sexual violence. And those who've experienced sexual violence are 37% of the girls have experienced STI. And there's also about 21% have experienced, if the girls have experienced physical violence. So there is this relationship between the experience of violence and experience of STIs. And when we put this into the regression model, I'm just presenting bullets, no tables. The girls who experienced sexual violence were more likely to perceive themselves at higher risk for HIV, and the girls who experienced sexual violence also had increased odds for an STI symptom. So we're seeing the connection that the girls who are in these marital relationships, and we're controlling for age, marital status, schooling, but those who are experiencing sexual violence in particular are more closely associated to HIV risk. So then we also asked about whether girls are seeking any services for gender-based violence. And here's the unfortunate thing. Only 14% of the sample had ever sought any counseling or support for gender-based violence. We looked at it by marital status, and it's still fairly low. We also asked if the girls had sought help after they experienced sexual violence, and here, this is the sad percentage you should look at. It's 1.9% of the girls, 2% of the girls had said that they had sought any help. And there is, now the sample size gets really small here, but more married girls are seeking help after they experience sexual violence than unmarried girls, but these numbers are still very low. So in terms of, Charlotte had said, what can we do? I think here's something that we can do. We can think about this. The other thing I thought was interesting, we have a set of questions in our survey that ask about norms, and I'm just presenting 2 of those sort of normative attitudes here, and these are norms around intimate partner violence. So girls are asked, are there times when a woman deserves to be beaten, or a woman should tolerate violence in order to keep her family together? And I think the positive thing here to look at is the giant gray bars, that most of the girls do not agree with these statements. So they don't support the norms around gender-based violence. And we also asked about other social support that the girls have in the community. We have a set of questions. I'm pulling out 2 here to say, is there a safe space for girls to go, for these women to go in the community? So if they don't feel safe at home, can they go someplace else? And 64% of the girls say they do have some place outside of their home that they can go if they need support. And we also asked if there's another adult woman in the community whom they could go to for help or support if they need it. And again, you find women who say that they do have such a person. So there is maybe some social support. So what does this all mean? Well, one, I think reconfirming in this smaller setting what Rachel was saying, that we have, high experience of sexual and physical violence among married girls. That experience from sexual violence is associated with increased HIV risk. We see low rates of use of gender-based violence care, and so that also begs the question, what is the quality and accessibility of these services for young women? When we designed the survey, we asked specifically if there were services. When we ask about are people seeking, we said, are there actually services? We talked to implementing partners. They do exist. We found out the names of the centers. We included them in the survey. So the services theoretically exist, but what is the actual quality? Are girls actually able to access it? I think those questions remain to be answered. I think this is something that this group knows very well. There is this need for sort of system-wide integration and screening for physical and sexual violence and post-violence care, both in HIV prevention and especially in antenatal care settings. But I think what we may not have done yet is look at how we can tap into the gender norms, the more positive gender norms that don't support gender-based violence, and how we can tap into girls' existing social support networks to both prevent and link them into care. So I think there's some work that we can do there. And I'd just like to thank, this work is funded by the Gates Foundation, our research team, and then the implementing partner who's given us amazing access to the study site, the APIA Plus team at PATH. Thank you.
Oh, wait, is it on? I've never had panelists who stay on time so well. It gives me power. No, it's great. So clarifying questions from the room. Rachel, you get first.
Just out of curiosity, you presented data that showed the girls' perception of the likelihood that they were infected with HIV, and I'm wondering how that's measured and whether or not girls see marriage as a risk factor for HIV in this day and age.
Yeah, I can answer the first one. I'm not sure about this. Well, I can guess on the second one from previous work. How's that? Yeah. The first one is actually, it's a simple question that has been used in other epi-surveillance surveys as well. It's what is the likelihood that you have been exposed to HIV, the virus that causes AIDS? And it's a categorical variable. So very likely, somewhat likely, it's 4 categorical variables. In the work that, prior to coming to the council, the work that I did in Uganda that looked at factors associated with HIV acquisition, we found that that variable could predict HIV acquisition, actually. So the girls knew fairly well who their partners were and their partners' extended sexual networks and what might be exposing them to risk. And so that's why we tried to use that in the survey as well. Whether girls think marriage is risky, I think to the extent that, depends on, my guess would be depends on what they know about their partner or what they don't know about their partner. The less they know about their partner and his whereabouts, the more likely to think about how it associates with their risk. Whether that's within a marital context or outside, I think that, not sure.
See, Meg Green over here, who leads the research group on child marriage, so I have to give you the next question.
Thank you. Meg Green from Greenworks. This is wonderful, and I'm really interested and excited that we're like the first to be exposed to your data. You referenced intending to address norms, and that kind of emboldens me to ask you about something that I've really been struggling with, which is that when we identify services as one of the key responses, we're individualizing a social problem, because and some of the ways, like different ways that we could think about it, of course attitudes towards IPV are really important, but what about attitudes toward divorce or attitudes about sexual double standards, and which are kind of deeper and are, I think, at the core of the problem. So then when we're thinking about the response as being service-oriented, I worry that that puts the responsibility
On the
on the individual,
Yeah.
and I'd love to hear what you have to say about that.
I agree with you entirely, and I think the approach has to be a multi-pronged approach. And I think within the context of the DREAMS initiative, that makes sense because there is a focus both on services as well as community-based interventions. And so, they're engaging parents, they're engaging community leaders. In fact, we had a great sort of study initiation meeting with all the community leaders saying, we really need this program, we need this service, we're glad you're doing the research. So I think we need to capitalize on those sort of networks and interests and do the community-based change, but the services also need to be there to connect, right? So the connection has to be there. I also agree with you regarding sort of more underlying power dynamics within relationships, and we do have that data. Just didn't get here in the last week. But yeah, and we do ask, about power dynamics, about what the partner can do, the kinds of, both in terms of mobility, other partnerships, and I think those will be interesting to look at, what the girl's responses are in terms of her sort of general gender norms, but also specifically in terms of the relationship.
Jeff?
And Jeff from PRB. Your study's taking place along the lake, along Lake Victoria. And the history of HIV in that region was heavily dealt with both the traffic, fishing, and mobility, and everything else that played out. So can you talk a little bit more about what's known about the partners that we're talking about? Because sometimes you mentioned gender-based violence, and sometimes you mentioned intimate partner violence. So for the unmarried, what do we know about the partners? And for the married, getting back to kind of your question, some of this violence may be intimate partner violence. Some of it may be transactional. I mean, at least historically, what we had was transactional for fish, transactional for other kinds of things, which gets into what are the community standards, what are the norms, and so therefore, when you get into services, how do you address that? Because they're interlinked, but if you don't think about them as being interlinked, then how do you address them?
No, that's a fair question. For this, when we did look at who the partners are, most of them are boyfriends or men they live with. So common law marriage or marriage. I think there probably is a fair bit of transactional sex, knowing the dynamics of fishing communities. Girls don't report on it as much. We asked about their main partner, and we asked about their another more recent partner or any other partner, and I think it was like 2% of the sample reported a second partner. So maybe the girls don't have a lot of partners, but I think it's more likely a reporting issue. And that's not specific to our study. That's sort of, we know girls in particular are less likely to report about multiple partnerships, particularly ones that are transient. We are doing some qualitative data collection with the girls, and so I think we'll be able to tap into that. I know that the implementing partner, they're doing some monitoring data collection that might tap into some of this. So it'll be when we sit down and we're able to sort of put our data sets together, we'll be able to say something more about that, I hope.
And I have a question. You had mentioned secondary education in Kenya. Does that include married girls or girls who have babies?
I'm not sure. I'll have to check and let you know. I do know that I was surprised when we started looking at the data, started first coming in. I was like, did we ask this question wrong? What a large proportion? And we had extensive conversations both with our research team in Kenya as well as the implementing partner team, and it's because there is low-cost secondary education, sort of universal secondary schooling laws that were passed. I think theoretically they're supposed to be available to anybody, but I think if it's similar to what I've seen in other countries, usually girls drop out once they have a child.
Mm-hmm. I'm just thinking about that as a possible policy action.
Yeah.
That would. Yeah.
Well, Uganda is not the same country, but in Uganda we found that the motivation to stay in school actually delayed both sexual activity and marriage and childbearing. So the schooling was such an impetus, right, to push some of these. So I think the secondary schooling programs could have a much broader impact.
Any other questions in the room?
Hi, Charlotte. This is Rose. Can I ask a question?
Sure.
Yes. Hi. Thank you. I know that the Dreams Initiative is supporting sort of a comprehensive package of sexual and reproductive health care for young girls, and so I was wondering if, in addition to looking at sort of HIV and STI-related outcomes, did you also look at experiences of unintended pregnancies among the girls and perhaps the outcomes of those pregnancies?
It's a great question. We do have questions on pregnancy experience, but we haven't done that analysis yet. I don't know if we tap into the intendedness of pregnancies in quite the same detail as many of the DHS surveys, because it wasn't a major focus. I mean, it's part of the DREAMS package, but the major outcomes really of interest were HIV risk, so we were trying to capture those more succinctly.
One last clarifying question from me, and then I'll go. There's one more in the room. So are you going to be able to get more information about why girls can identify helpers or someone to reach out to but don't, and also why they don't access health services?
I think that's a good question. Part of the reason I think the girls say they have support is part of it is by the program design. So one of the things that the Dreams Initiative is doing is using sort of girls mentors thing. And we need to unpack that question, and then the qualitator will be able to figure out a little bit are the mentors the girls that, the other adult that the girls are referring to? If they are, then they can be better connected to services. If it's other adult women, unless those adult women know about services or know how to counsel somebody who's experiencing physical or sexual violence, I think that connection to services will be harder. So I think there are things to be unpacked still.
One more question in the room.
Actually, this was more in response to your comment on after birth for girls staying in school, and I wanted to check the Step Up program in Kenya that has done a lot of really great work to change and start implementing new policies within Kenyan schools to keep girls in secondary schools after they've had a child, to sort of change the change of social norms and change the school policies, and then also on the actual national law end. So we'll see if that ends up having more of an impact. So I thought that I wanted to be sure to bring that up if there's something you wanted to look into. I apologize. I'm Jamie Kwam. I'm also from Population Council.
Thanks very much. I think that's all the clarifying questions. Thank you, Sonia.
Thank you for letting me present what your comments.
Hot off the presses. So our next presenter is Jeff Edmeades, also from ICRW, and Jeff's title is Child Marriage, Couple Communications, and IPV Insights from the TESFA Project in Ethiopia. I think many of us know about that project. Looking forward to hearing the evaluation. Jeff Edmeades is a senior social demographer at ICRW with over 15 years of experience in conducting research, designing, monitoring, and evaluation approaches and program design. Dr. Edmeades' recent research focuses on the determinants of contraceptive choice, particularly within household decision-making processes, the design of effective programs addressing child marriage, the linkages between pregnancy and school dropout, and the evaluation of programs addressing child marriage and comprehensive sexuality education for adolescents. Many of the questions that surfaced in this room, so I look forward to hearing more during the general discussion. I believe you all have the full bios of everyone, so I'm going to let Jeff start without further ado. Thank you, Jeff.
Thanks. I spent basically the whole weekend outside in the freezing cold at soccer tournament, so I'm in need of some water. So I'm really glad that the order of presenters played out the way it did, because I think it's really important to be thinking about data that is gathered from girls who are married. So I think the DHS and other sources give us a tremendous amount of insight by looking at older girls and comparing, looking retrospectively at how the age that they married at. But there's a real gap in our information and data and understanding when it comes to really looking at child brides themselves. So we're often having to sort of triangulate pieces of information, and I think it's important that we be looking as much as we can at data that is pulled from those girls themselves, which is challenging. One of the pieces that I'll be presenting on today comes from a really innovative intervention that was conducted, I guess now starting about 5 years ago, ended in 2013. So this is not super new stuff anymore, which makes me sad because I haven't got enough work out of that, enough publications out of it. But this project was implemented by CARE Ethiopia in the Amhara region of Ethiopia, and focused very specifically on girls who were married or had been married. So as I'll discuss a little bit when we get a bit further along, there's some really interesting features of Amhara that make this an interesting area to look at. Now, despite the fact that I have evaluation data, I wasn't focused on IPV specifically. So a lot of what I'll be looking at today is a little more descriptive, but there are evaluation findings behind those. So the TESPA program was implemented in 2 waradas in the Amhara region of Ethiopia. Now, the Amhara region has historically had some of the highest rates of child marriage anywhere in the world. Because we saw from Rachel's presentation, Ethiopia is one of the success countries in terms of looking at the decline in the prevalence of child marriage. There's a lot of different reasons for why that is, but it is an interesting context to be looking at from that perspective as well. But these girls were aged 14 to 19 at the time that we did the study, and they really were probably at the leading edge of some of the changes that were going on in terms of the declining rates of child marriage. The child marriage nonetheless remains very, very high and very common. Arranged marriage is the norm. And so girls are often promised in marriage when they're very, very young. That also has been shifting over time. It could be, in the past, you would hear stories of girls who were being promised in marriage essentially before they were born. So families would have arrangements in place. Now it's a little bit different. But we still have, particularly in rural areas, very high prevalence of child marriage. The program itself started by looking at 5,000 girls between the ages of 14 and 19. Most of the girls are a little on the older side of that age range. We had a pilot program at the beginning to test out some of the implementation components. So the actual evaluation is based on slightly over 3,000 girls. The intervention itself, which I won't go into great detail today because I think it's more relevant to talk about the components of the intervention that are related to IPV, really focused on 3 training arms. One was very focused on SRH, one was a kind of economic empowerment arm, and the other one was a combination of the 2. And the broader goal of the study was really trying to tease out which was the more effective in terms of SRH and economic outcomes. And in there, we collected a whole bunch of data about other things, including IPV. So CARE really, in thinking through, at the time there was just very few models to think of how to work with this particular age group. There still really aren't a lot of studies out there that are focused on intervention work with married adolescents, which is a gap. It remains a gap. It's an important one if we're thinking about child marriage more holistically. So part of the issue is that this is a population that really falls through the cracks. And those of you who've heard me present about this have heard that line multiple times. It's because it's true. And what it is these are girls who we focus so much on prevention, but then their marriages weren't prevented. So those programs stop worrying about them once they get married. They're not in school typically, so they're not captured by school or social protection programs within the school system or any interventions that go through the school system. we know they don't use healthcare very much, so they're not also captured very effectively by anything that works through service provision or on the service provision side. And culturally, socially, they're pretty much invisible. So they'll move away from their home into their husband's home and in their husband's village often, and then become quite constrained in terms of their mobility. So Ethiopia doesn't have the same mobility constraints that you might see in a lot of South Asia, but the chore burden and the amount of household tasks that these girls are in charge of essentially confines them to the home by and large. They're, remember, taken away from any support networks that they had. So their friends in school, their friends in other places in the community are lost to them often when they move. So CARE tried to construct a model that would allow for a flexible approach that would work essentially in creating types of safe space groups for these girls to meet in and to receive programming and training in. And they built that on the platform of their VSLA model, which is really focused on groups that gather to, and the VSLA is the Village Saving and Loan Association, so it essentially has an economic component to it. But they did this for the SRH too, and so girls would meet regularly. It turns out about every 2 weeks or so they would meet. They would define to a certain extent who, the length and the parameters of those group meetings with guidance from CARE. And then it's a peer-educated program. So two of the girls' group would be picked by the group, nominated to be the trainer, and they would be they had to deliver the training. But partnering that, I think, was a really innovative piece that CARE brought in, which is now, I think, becoming much more standard and is considered less innovative, but at the time it was, is really working much more directly with the community. So in Ethiopia, we have this large community conversation type approach is often used in programming at the very start. But what CARE did that built on that was to have people come together, discuss the program, discuss the community needs, and then nominate at the community level a group that would work with the project, sort of liaising between the girls and the project itself. And they received their own training curriculum. And at the time, I was so focused on the girls that I wasn't paying as much attention to what was going on with these social action and analysis groups. They had this really interesting sort of gender power piece, which I sat in on one session, and they would sit down and say, well, who has power in the community? And they'd go through this whole exercise. And the structure of these groups was, even though they were community nominated, they had to have certain diversity components to it. And so they really was uncovering and rethinking and challenging community norms and helping them think through it in different ways. So I think CARE has gone a long way with this, and they can, they'll have much more if you're interested in it. We'd be happy to put you in touch with the relevant people. But it really is an interesting approach, and it's built very much, it really reinforced what was going on with the girls, and I think that mattered for many outcomes, including the determinants of IPV as well. So again, Ethiopia has historically high rates of IPV, performs pretty poorly on gender indicators overall. Obviously is a very poor country still, even though it's growing rapidly and has experienced a tremendous amount of change over the last decade or so. In this area, arranged marriage is the norm, and as I said, IPV wasn't a direct focus of this program, but you can't really look at SRH without looking at IPV, and so it filtered through many of the other pieces of the project and different components. One piece that I think, and this is what I'll be focusing on much more today, is thinking through the role of conflict resolution training and basic negotiation training. And we initially had included those because we felt that when you're talking about different components of reproductive decision making, that you would need to have some sort of piece where the girls would be able to negotiate that effectively with their partners. And that was extended out to the economic piece too, because clearly there's points of negotiation there that have to happen. And it really wasn't intended to be couple-oriented so much as providing a framework for thinking through how you have discussions. And that ended up being something that really came out very strongly in terms of what the girls felt they got out of the program and the more immediate impact. And I think has a direct effect on IPV. So what we really were seeing was these shifts in couple communication. And as you'll see, communication exceedingly poor. So any kind of shift has potential for an effect. So very quickly, the data that we have, we collected baseline and line data from a cohort of girls, so the same girls at both points. So we have effectively an ability to control for their own individual characteristics over time. The intervention was a year long, and this is something I'll come back to because while that's great, it's very short, it makes measurement really challenging. Again, a focus on SRH and economic empowerment, but also a lot of collection of other pieces of data, including experience with intimate partner violence, relationship characteristics, the communication pieces, but also decision-making and other components. Some very straightforward mental health questions, which is something that I think is also a gigantic gap in our knowledge for this age group. It's something we need to think very carefully about how we would measure and what we, where we think it plays in. I'll talk a little bit about that further in. And then again, this within the context of an implementation and intervention, a quite unique focus on married girls who are, as I said, is very marginalized, ignored group by researchers as much as anybody. So we asked the basic questions, which you've already heard some of, and you can see basically there's quite high levels of partner violence in this population. What I'm not able to show you right now is how this compares to the norm, because I do think that it's interesting. Rachel's work is finding this large effect. A lot of the other work I've seen doesn't find that, because I think very often those things are co-determined by a bunch of other gender factors. So violence is high for everyone, and it's higher for girls who are married, but it might not be so markedly higher that you can see it. And I think there's a lot of variation around that, and I'm glad to see that you found such robust findings. I think it's important that we're establishing that linkage more strongly. Here, what we do see is what I think of as it could be emotional violence or psychological violence, intimidation, scaring, insulting. That is very common. And then down the bottom again, as we saw in some of the statistics presented before, levels of rape within marriage that, I mean, this is almost certainly underreporting. And as Rachel laid out, I think there's some real measurement concerns around how we ask this question. But still, we're talking about a quarter of these girls who are reporting being raped, essentially within their marital relationship. So what about these relationships? What are the characteristics of these relationships? Thinking through communication, because that's what I'm trying to focus on for today. These are the groups that responded never. My husband and I never talked about these things. And this pretty routine things, but there's a core group of girls who really just have extremely poor communication with their husband about routine events happening in the community, decision making around money, those kind of things. And what's interesting here is I think in some ways this probably overstates the level of communication, because the other categories are often and then sometimes are lumped together here. And if you look specifically at the financial question, most of the people who are not never are sometimes. So it's really not that there's a huge amount of communication going on any of these areas, and about 7% of the girls in our sample said never to every single item that we asked. And so they may have there may be specifics about their relationship that drove that, but overall communication is pretty awful. And so what we have there, and we need to remember within the context of arranged marriage, they don't know each other typically in this context much at all. So what are they going to talk about, and how are they going to figure that out, and how do you establish a relationship of any kind is a very tricky issue at the couple level. For the men involved and the girls coming into the marriage. Thinking through mental health. Now, I think there's a couple important caveats here. I think measurement is really tricky. We very often are applying either diagnostic tools to that have been refined and developed in a Western context to other contexts without the kind of deep testing that we need to do. And I think there's some really profound interpretational questions on how words are interpreted for these things. So feeling sad or happy or satisfied, they just have different cultural meanings and context in different places. And internally, I'm not entirely sure. For example, the question on do you feel unhappy isn't internally in our survey all that consistent either. But the issue here is, I mean, and it is important to remember that now if you look at the global level, the leading cause of death for adolescent girls is suicide. And where is that coming from? What role does child marriage play in that? And what role does being in really bad relationships play in that? And I tend to think that there has to be some contribution to that. This is something that it's an area of research that we really need to be diving into. And there's so many things to unpack in there, measurement and causal direction and thinking about these things. But if we don't do that, how are we going to be able to explain this question of really persistent symptoms of mental anguish and distress that we find pretty consistently? I mean, I think it wouldn't be unusual. Shall I stand way over here?
Yeah, that would be great. Thank you.
So basic diagnostic things about sleeping or feeling anxiety and nervousness, those things, recent work that we just did in Ethiopia, qualitative work on that, really found that this was a major theme for girls and women. This is a feeling of anxiety and nervousness. Now, again, in context of poverty and resource scarcity, it's likely that those are pretty pervasive feelings. So the question is, what role does child marriage play in contributing to those things? And I think that's an open question. So when we looked at the effect on IPV, we did it in possibly the crudest way that you could, putting stuff together in an additive scale. So yes, I know that it's not how we should do things, but this was done very quickly. And so I think there's a lot more that we could do with these data as well, and as well as new data that's coming in now. But really thinking about what we saw quantitatively, we saw very significant change, but we saw it in the control arm as well as in our intervention arms. So it seems like, and this is not unexpected, that the longer you're in a relationship, the more things sort of settle down. So people get to know each other a little better, the rules and definitions become clearer, and so length, duration of relationship probably contributes, even though this was only a year, to some of that decline. But I do feel that there were very significant changes that happened during the program that are not captured by the quantitative measures. And as usual, we were asking these questions over in the past year. Now the program was a year long. So if you ask that at Endline and someone experienced violence a month into the program, they're going to say yes. So in hindsight, I would have asked the question quite differently at the Endline and looked at shorter time frames to try to capture that change. Because what we're not going to see for sure is a drop-off in violence, a precipitous decline in the first 2 months of the program. It's going to be something that's incremental, in my view, and will take some time to really play out. And so I think in the context of evaluations and program evaluations where the time frames are so short usually, we need to think about what's a realistic time frame to be expecting to see changes in these kind of things that are so determined by some of these more background factors around norms and attitudes and discussions. The qualitative findings really came back and enforced the fact that it was this negotiation component that really was driving so much of what girls felt they were getting out of the relationship. So there's a couple examples that I'll show here, but when we first did this, now when we spoke to the girls, they were saying things, well, you know, usually what happens is my husband or my in-laws decide that they want to do something that I don't want to do, and I'll run away home, and then my parents will negotiate my return for me. And that was kind of how conflict was resolved. And that is, I mean, you can imagine the potential for violence and other pieces in that kind of dynamic. What they were saying was, I now have a way of starting a discussion. And I think they were finding that when they start that discussion, everyone's happy that there's a discussion happening. Not everyone, but enough people are, that it was creating an environment where they were getting more of what they wanted. They were feeling more respected and listened to. And they were feeling that their relationships were better. And they found that to be, in the first sort of that first 6 months of the pilot and the first part of all the projects, that was where the largest impact lay. It wasn't, it had effects further afield from that in terms of our core outcomes, but really, they were really focused on what it meant for their relationships and how that improved their lives in really tangible ways. And all it really meant was that they had no understanding of how to even start the conversations. And once they were able to have a kind of framework for how do you negotiate, how do you resolve conflict in a way that doesn't involve sort of escalation to conflict, I think was very effective. And I think points to the importance of thinking about where is violence happening for married girls. At least in this context, it's within their marital relationship. So what is it that we can do at that level that can change this? So yes, there can be legal changes, but we know that legal changes aren't going to take you so far. The literature on IPV shows that there's only a limited effect of legal changes. And so here, I think this is one of my favorites. One part of at the end line, we conducted some qualitative work, and we had a photo voice exercise where girls took cameras out into the communities and took pictures of things that they felt had changed as a result of the program. And one of the things that came back that I hadn't realized happened and what was in a simple level of change, but very profound, was a tradition of the husband would come back from the field and the wife would wash his feet. And they would both be out working in the fields. They'd come back, but she was washing his feet. And we had it twice, once in the photo voice and once in the qualitative, very specific stories about how the men had decided that wasn't fair or appropriate and they would wash their own feet. So baby steps, but I think symbolic of some really more profound changes. And we saw these patterns consistently enough that I feel much more confident that there were these underlying baseline changes happening that would result in shifts in IPV. So I think the lessons that we learned there are much more about thinking about the couple as a unit of intervention for these types of activities, thinking about how we can enhance couple communication, and really starting with the basics. Let's not assume that there's any communication that's going on. And also not assume that people really understand each other, because they don't know each other. They haven't typically been in relationships before. They don't know what they are doing, and they have no framework for seeing that necessarily, even in their own homes, in terms of discussion and going back and forth. So thinking through, and again, a lot of people are doing really great work now in the sort of life skills communication pieces. And I think that's really a critical piece. I think though, I think we all need to acknowledge that whatever we do, if we're not changing that underlying logic that drives child marriage and drives partner violence, or justifies it, or enables it, or provides a context where that's acceptable, then we're only going to get so far. And what we're doing here is sort of cutting it off at the pass, getting in before the violence takes place. And then I think really understanding how can we demonstrate causally that child marriage is having an effect, particularly in contexts where violence is pervasive and child marriage is also pretty pervasive. Where's the causal linkage there? And I think we're beginning to see some of it. Rachel's work, I think, is really helpful in that front, but it's really challenging. And even things like something like education, which I think as a field we agree is protected for girls, the causal linkages are all over the place for how it links to child marriage. And then I think really thinking very carefully about what are the outcomes that we're interested in here. And I think thinking about mental health in particular for adolescent girls is something that I hope that the next few years we'll see some really significant steps in, because I think it plays back into so much of what we see, and it determines so many of these outcomes and has such a profound effect on the lifelong prospects and well-being of the people that we're interested in. I think it's well worth looking at. So again, I think focusing on couples, really diving into thinking about how we can manage this in a way that is transformative, but also in very practical terms, just getting people to talk to each other about basic things. And thinking about dynamics of relationships and how those can be manipulated in the policy realm, maybe, but probably more directly in terms of interventions. Thinking back to the sort of thematic questions that we're going through. So what do we know based on this? I think we know that the relationships of child brides typically are worse in many ways than those who were married later. We know that this increases their vulnerability. We know that communication is very poor. Improving communication seems to have positive effects. Conflict resolution, negotiation, those are critical tools for any relationship. But the forum, the way to develop those, the ability to be taught those, is not something that we should really just be assuming and take for granted that happens within relationships, because it does not. And again, community support for these mechanisms is going to be a key process. What do we not know enough about? So we need to just, I think, dive further into the questions of how much worse is IPV for child brides than for other women, and are the effects uniquely bad for them? Is it kind of like one of these questions of fertility? So, they're getting started earlier, so they have more lifetime exposure to violence. Is that the totality of it, or is there something about experiencing violence at young ages in the context of marriage that's uniquely bad for you in the long run, I guess, damaging in the long run? I think the more we learn about brain development and cognitive development, the more we understand these sort of core effects at young ages and the effect it can have long term. I think it's an interesting area to try to look at a little more. And I think we do have the data for that, potentially, because you need just data on older women for some of that. But we need mental health data that's robust and reliable, which that's a little hard to come by. And then I think very carefully, what are the intergenerational effects of viewing intimate partner violence in your home? And this is perhaps less tied to child marriage specifically, but I think that some really interesting work has come out in the past few years showing this sort of repeating again and again of patterns, and how viewing this and how breaking this can break a cycle that lasts a lot longer. And I'm going to end because I know I'm over time. We finally published a piece from this. So I would very much encourage you guys to read it. And it's focused on the SRH outcomes, but it is out. Yes, I think if anyone wants to discuss any parts of the intervention design, I would point you to the folks at CARE. But any other questions, I'm happy to field those.
Thanks. Thanks so much, Jeff. So a couple of things. We're going to start with clarifying questions on this, and then bring all this presenters up here, and you can have at them for probably a half hour by the time we're done. I only have one copy of the evaluation report, but it's on the ICRW website. It's lengthy. So we'll give you the link to this and the link to the new journal article. Let me ask one truly clarifying question. So you talked about the communication part. Was that at Endline? The girls who were asked said that 25% never talked about family planning and 30% didn't know where to get it. And was that verified by talking to their male partners?
So first, that was at baseline. And we did see improvements in communication overall. Again, though, we saw improvements in the control arm, and I think that's partly sort of like the relationship effect. So the picture's a little murkier than for some of the other outcomes. We did speak to men in the qualitative piece. So there were some husbands that we spoke to. We spoke to community leaders and other men. And I think in the absence of a true sort of linked couple study, it's a little hard to tell how those really truly matched up in their experience. We do know that girls felt that they were quite supported in the program. So they would meet for an hour and a half, a couple hours, and they would gather in a central point in these areas. Now, this area of Ethiopia doesn't have villages, it has little settlements. And so the girls would often be away from home for sort of 4 hours at a time to attend these meetings and be walking for 45 minutes to get there and then hanging out together and enjoying themselves. They loved the groups. They had no other support social network. And that meant someone else was taking the chore duty. And that was something that was in part negotiated through the SAA groups, but also just an understanding that this was something that was necessary for them. And there were support. And obviously there would be those who were not directly supported, we know much less about. They were probably not participating in the first place.
So other clarifying questions in the room or online? Okay, looks like we're going right into it. Rachel, you have to come on up.
Just got my water.
Okay. Okay, Rose, you ready on there with your integrated question here?
Sure. Well, let's see. I don't know that my questions are integrated, but I do have a question for each of the speakers. This was such a nice panel, and you know, each presentation was so complimentary of the others, and so I just want to thank all of our panelists. First of all, this was really great. Let me start with Rachel. So, Rachel, first of all, congratulations on making really great use of existing population level data. I think that you know, the secondary analyses that you did with the DHS data really have made some substantial contributions to the evidence base on this topic, and I would imagine for a relatively low cost. So, that's amazing, and I'm really happy to see, you know, the data that you were able to put forward. I guess my question for you is, do you feel that there's more that could be done with existing data through secondary analyses on this topic? And if not, you know, what do you think is the next big research question to address? And second, of sort of two parts then, but for the existing analysis that you presented today, you know, we came across your name and your study because we found your article in the literature, and we were so impressed by the analysis and how many countries it covered and all of that. But we hadn't been connected to you through the task force or the IGWG before. And so I'm glad we were able to make this connection, because I think a lot of us in the room would be very interested in using these data for advocacy and for informing programming. And so the second part of my question is really whether you've thought about how you'd like to see these data used beyond getting them published in the peer-reviewed literature, which is great and important, but you know, have you thought about what to do with these data next in order to really see them applied in policy and practice? Do you want me to do my other two questions or let Rachel respond?
Why don't we let Rachel respond first?
Okay.
Thank you for those questions. It's not on. It's not on. It's on.
Hello?
Oh, yeah.
Yeah.
Okay, it was not on. So thank you. I think some of those questions tie into the limitations of the secondary data. I think they are incredibly rich and incredibly useful for analyses such as this, and I think there's still potential, obviously, to look at things like the impact of emotional violence and other research questions. And certainly this, I'll be frank, was a side project that I just was interested in, and I had the data at my fingertips and decided to run with it. And so, yes, it can be done at very low cost, and we can learn a lot, particularly when we have studies that are in one country, but we haven't really learned whether or not those findings are more broadly applicable. I think it's a great starting point. But I do want to add a note of caution to my findings, particularly listening to Jeff talk about them. I want to highlight that this is all cross-sectional data that I'm using. I don't know whether this is a causal relationship. What I know is that these two things are associated. And as I said at the beginning with potential mechanisms, some of the mechanisms may just be that the kinds of girls who have are coming from families with harmful gender norms where violence is accepted are also the girls who are getting married early. So it's not necessarily child marriage that is promoting the violence. Other mechanisms, like pulling them out of school to get married or setting up power dynamics where one is much younger than an older spouse, that is causal. I can't look at that in this data. So to bridge to what I would want is longitudinal data. And some of that you may be able to find, frankly, by piggybacking off other studies. I mean, you all have a lot of evaluation studies or even just, monitoring the implementation of different programs, and you have longitudinal data on these girls, and you can look at whether or not, you have baseline data on their social and demographic backgrounds, whether they're in school, what the economic situation of the household is, what their attitudes are towards gender-based violence before they get married at early adolescence. And then you can follow them through time. And so I hadn't thought about it in this context, but I'm about to collect data on about 3,000 adolescents in Malawi who are 11 to 15. And so this should mostly be before marriage. And this is one thing I could look at. I'm collecting all this violence data, both violence, I would say, against women, but also I think we should be looking more at violence and how it's perpetrated. So looking at the men, we talk about the women, but what are the conditions on that side that's facilitating violence? And so I'll make a note to look at some of these questions in my own data as they become available. But I think we can think more about not just the DHS data, but all of the data sets we have lying around that we never quite get to publish enough on because we're on to the next project. And I think that those are also valuable for some of these projects and some of these ideas. So one would be looking at the longitudinal relationships and understanding where we can actually intervene, whether we really should be focusing on child marriage or maybe it's just gender norms more broadly. And then the second place that I'd like to see more research, and I don't know if I'm the person to undertake this, so I'll make a plug. I'd love somebody else to take the mantle, is really trying to monitor the implementation of some of these laws. And I'd like to see, that's a government level thing, but at a community survey level, I'd love to know whether girls are aware of a minimum age of marriage, whether they're aware of the risk that comes with marriage. I mean, we've been talking about the association between marriage and HIV for, well over a decade. I think everybody in this community knows those are intimately linked. They're having frequent sex with an older partner. They're at more risk of HIV. But I don't know that girls know that marriage or intimate partner violence is associated with that risk. And I don't know that they know that the marriage below 18 is actually illegal in many of the countries and the communities in which they reside. So I'd love to see some of that integrated. I don't know that these need to be standalone studies, but integrated into some of the ongoing work that's already out there. Mm-hmm. Did I miss anything there?
No, that was great.
Great.
Sonia and Jeff, do you have anything to add?
Can I add just one thing to the secondary analysis? I think I think all three of us used similar measures of physical and sexual violence, or maybe similar. So one of the things that's held us back in sort of looking at these issues, even across countries or across specific studies, is there has been limited alignment of how we measure physical, sexual, and emotional violence. And I think as a group, as the we who are interested in these topics, I think if there's greater clarity and alignment of how we're measuring these things in a reliable way in different contexts, I think you can have more consistent answers, whether it's from smaller studies or larger things. So I think we're getting there, and so I think that would be one of the nice things to come out from these discussions, is that the alignment of measures of how we're measuring certain things. Are we looking, and also even with child marriage, are we looking at the before 15? Which I really loved your disaggregation, and I've done simple, like the 5-year age category analysis, but I think can be more fine-tuned in that. So I think that helps. That's all.
Yes, so I think the call for longitudinal data, I mean, this is something every researcher wants for every topic that they're interested in. I think in terms of thinking through the consistency of measures, I agree, though I would caution that I want to be sure I'm measuring what I think I'm measuring with them. And I think, I certainly, when developing the survey, did not have the resources to go in and do formative research on every little topic that I was interested in, so I took the basic set of questions. And I think it's beneficial to everyone for us to every so often revisit whether those questions are capturing what we think they are. And I think, Rachel, you pointed out a couple cases where it's like, what is force? What does that mean? Do people interpret, if there's no conceptualization of such a thing as rape or forced sex in the context of marriage, how are they going to report that? So I think there's still questions to be asked on the measurement front there. I would like just to comment a little bit on the legal issue. I mean, I think that the challenge there is, what are we hoping to achieve with the legal things? How do we think it really would work? And in the context of Ethiopia, what it has meant is that when police or the authorities are alerted, they will come in and arrest the parent of the girl. And that's just not a desirable outcome in any real sense. So if we think about the mechanics of what we're talking about, so virginity and the desire to protect virginity is a major driving factor in this part of Ethiopia behind child marriage. So the girl is married, she's presumably sexually active very quickly, is no longer a virgin, so therefore is not marriageable in that sense anymore. Are we going to force divorces? And what are we offering the girl in return? What do we say? Are we saying we're going to break up something that it might not be great, but there is? What are the viable alternatives for someone in that situation? Are we going to be arresting their parents? What does that? Does that reverse the marriage? If you can get in and prevent it, great. But if you're not being able, if the law enforcement is primarily reactive, which I think it almost always will be, I think we have to be very careful in terms of advocacy of what we are actually asking people for and what we think those outcomes will be. Because in my view, many of the enforcement question is secondary to what, do no harm should be our start. And I think the legal issue very often does great harm to exactly the people that we're trying to help. Now, it may be that that's a sacrifice that in the long run is worth making, because it sets an example that changes behavior quickly and more profoundly. But we have to be very aware that that's what we're doing.
I mean, there is evidence. I was going to say there is evidence, ethnographic evidence from Uganda, where they have a very specific age of consent law, 18, and if you're caught, it's actually the partner who's put into jail for life, or there's a death penalty associated with it. So there's very severe punishment, and people there do know about it. And what ends up happening is that when there's these, young people in relationships, and the boy can't pay bride price, he runs away. He actually abandons that partner, and she's then left to fend for herself. So opening up a whole different range of circumstances for a range of poor outcomes, health and violence and transactional sex. So I think you're right. Like, what is the end game? How are these things being implemented? What do people know? Yeah.
And if we just shift it from formal marriage to cohabitation, I'm not sure we're doing anybody any good either, because then they're still living with their partner, and subject to most of the same adverse outcomes, and yet have no legal protections that come with marriage or social protection. So I absolutely hear you and agree that this is a really complicated issue, and I don't think it's been well thought out.
So Rose, do you want to keep going, or there are a couple of questions in the room? You want to hold on?
Why don't you give others in the room a chance?
Okay. All right. Hold on one second. Jill.
Jill Gay, What Works Association. First, thanks to Charlotte for a fabulous session pulling this together. This is really just illuminating. I have a question for Sanyukta. So Kenya is one of the few countries that I've seen that has an adolescent-specific HIV plan. Mm-hmm. Has that made a difference? Are you looking at, I mean, obviously we need to know if what's being implemented, but the fact that they even have a plan on adolescents and HIV compared to many of the other countries is huge.
Yeah.
And I think plans are sort of the first necessary step. Mm-hmm. Getting it implemented is the challenge. And my question for Jeff is the sustainability of the project that got done in Ethiopia. It's amazing work. Is CARE carrying it on? What's happened to it since you've done the study?
Do we want to take a couple of questions at a time? Is there another one ready or still percolating here? Hold on, Nicole.
Hi, most of you know I'm Nicole with PRB. So I'm really curious. I mean, all of the studies were focused on women's experiences. So I'm very curious about the reaction of men in the community and how you navigated that with the research collection, but also like what are the implications of incorporating men into future research and studies about this topic? Because as we know, those are the people that are perpetuating this. So I'm just really curious to hear your feedback on that. Go ahead.
Sure. So Jill, thank you for your question. I think it definitely helps that Kenya has an adolescent-specific HIV policy, and my sense is that they're further along with some of the DREAMS implementation than other countries because there's been a lot of in-country buy-in. And the ways historically that Kenya has structured HIV programs, so they're divided geographically by region, so one group sort of does everything. That has its strengths and challenges. So I think there is a specific structure that was pre-existing that allowed both the Kenyan government to really adopt some of the DREAMS initiative sort of programming, and the structure I think helped push it down at the community level in a quicker way. This is totally sort of my impression of it, looking at several other countries where there are sort of different models of the program implementation. I think South Africa is the other one that has an adolescent-specific policy, but that's a sort of a very different context and environment, so I think it functions differently. I do believe the reason that Kenya is one of the first countries that has also adopted oral pre-exposure prophylaxis is partly because they've been very forward-thinking and about what's new and cutting edge and what can be added to the HIV prevention package. So I think having the policy and knowing that there are policymakers that are interested in these issues has certainly helped that along.
Can I make a brief comment there? Because I wonder about sort of the personal connections with this, because Nduka Kalonzo, who's the head of NAC, who's on our board, was one of the ones who first wanted to do studies on oral PrEP in Kenya. And so now that she's in government, I think that
there's only of the 10 DREAMS countries, and oral PrEP was supposed to be a package for the DREAMS countries. There's only 2 that have national regulations on how PrEP can be provided. That's Kenya and South Africa. Others are sort of still either wanting to look at feasibility and modeling studies and whether it would be cost effective. There's a lot of concerns about behavioral disinhibition and others, right? So I think you're right. There is a personal connection, a personal interest that really helps push things along. Should I go ahead and respond to Nicole? So Nicole, that's a great question. Unfortunately, in Kenya, we're not going to be able to look at men's experiences, but we are doing a similar study in Malawi where we are speaking with both girls and their partners in the same communities. So we are in fact going to be tapping into some of the gender norms and particular norms around violence from both perspectives. And I mean, it's whenever possible. I think getting both sides of the story and experiences and sort of the norms and structures that facilitate violence, I think it's important to capture. So stay tuned.
So unfortunately, we don't have data in the DHS that talks to the male perspective, and I've fallen admittedly into the same trap. I just finished data collection on violence among HIV-positive adolescents. It was a larger study, but a lot of it looked at violence. And we looked at family violence, we looked at community-level violence for boys. We didn't actually ask them about their intimate partner violence. We asked only the girls. And so I'm prepping a new study in Malawi that I mentioned, and we are going to be asking, it's 3,000 kids equally split by gender, and we will be asking both about their experiences of intimate partner violence using the same instrument that you are there, because we want it to be comparable. And we will be asking, and I was just going to say, and I haven't found any great scales for perpetration, so if anyone does know of any, please approach me. But what I've done is just adapt the same scale to ask about whether they've done any of those acts in their lifetime or in the last 12 months, because that's a huge gap. So, Nicole, I'm glad you brought that up. We don't know as much about trajectories of violence perpetration. We talk a lot about, girls who are exposed to domestic violence are more likely to be victims when they grow older. We don't talk about boys who are more likely to experience domestic partner violence and how that trajectory works, and why there are some positive deviants who are exposed to a lot of domestic violence and community violence and who grow up to have very healthy relationships. And those are the kids we'd like to look at more and see what their social supports were. And so hopefully we can do that, but come back in 5 years.
I think Carrie will make the point that there is men's data in the DHS, and there are couple data too, where linked couples. There has some challenges, and it's I think a much more limited set of countries. But Carrie, do you want to? You know much more about it.
So the domestic violence module has actually been implemented in both the Uganda and the Ghana surveys, and there's a publication out analyzing those data for men's experiences with violence. There's also in the domestic violence module a very oversimplified direct question of whether women have perpetuated violence that was not in response to violence that they were experiencing. And then I was also going to mention the couples data. We have couples data sets which are matched couples from the women's surveys and from the men's surveys, where if they're cohabiting and in the household at the same time that the survey was implemented, and the husband, says, this person in the household roster is my wife, and the wife says the same thing, then it's a matched couple, and we can pull the men's data and the women's data, including if the domestic violence module was done in that country, her experience of violence, and that would get you the men's answers on the full questionnaire that men are asked in the DHS survey. So those are a couple of data points, and Jeff rightly points out they all come with some of their own limitations.
And I think Meg is going to comment on that. So I think that there are some really interesting data coming out around interventions focused specifically with boys around changing gender norms, and really particularly focused on violence and different pieces. And I think that this is an area that I think is now coming out of that emerging stage and now becoming much more consolidated. We have cross-national survey data now through images that captures an awful lot of that, and it captures. I mean, one part that I find very interesting about it is this concept of the intergenerational pieces. So they're asking about exposure of people during their childhood to violence in their home, not necessarily themselves as victims, but seeing others as victims in their home, and then how that seems to just have this, chain effect and influence their lives. And Meg, I'll let you expand on that a lot more. But, I think the work that Pramundo, Sonke, and others have been doing around measurement and around interventions, I think is quite promising. And I think from a practical standpoint, we are not going to get as far as we need to without really figuring out how to work with boys and men. And I think gender transformative programming is absolutely going to have to be a part of that. How the mechanics of doing that in a way that's protective and inclusive of women in the process. I think anyone who's dabbled even a little bit in that knows how challenging that can be. But we need to figure this one out, because if we're not including men, and we need to also not be treating men from an instrumental process only, right? They're not tools to an end for women. They're individuals who benefit from these processes as well. Now, women may benefit even more because they're existing in this construct of gender inequality, and so the benefits are probably much larger in some cases for women than for men. But I think all the data on risky behavior by men and ideas around risky masculinities and how we can transform those are, I think, clearly beneficial to men and to women. So I think, yes, it's challenging, and yes, we always are running into these issues as we collect data, as we do interventions. But again, as my presentation ended up very much focused looking at couples. Couples are two people. And so we can't just look at the woman and think, well, we'll teach her. It's not fair to the woman either to assume that they're going to bear the burden of transformation on their own. Why would we take the most vulnerable person in a relationship and say, well, go ahead and change your relationship, make it better? They're not the ones with the power in that relationship. Why are we burdening girls, young girls, 14-year-old girls, with social change in their communities? It's silly, but we do it over and over again. We need something that's more holistic. And more holistic means working with men, working with other people as well, and not assuming the change is going to come from individual girls. But that's, Meg, I'll let you go ahead.
Well, what he said, and also that masculinity and femininity don't exist separate from each other. They are defined in relation to each other, and so it's really important to address various dimensions of both things and not put it on the disempowered group to transform and change and so on. I did want to just take a step back regarding the images survey, which you might not be familiar with, Rachel. It's the International Men and Gender Equality Survey, multi-country. It doesn't survey couples because it asks so many questions about violence and expectations in relationship and so on, but it does do it looks at men and then collects a separate sample of women. And it's a very rich source of information, not only on violence, but a lot of other expressions of masculinity and gender expectations and norms and so on in relationships. And it's now been applied in many countries and being adapted to more.
I'll quickly jump in and answer your question, Jill, around so CARE has continued to work with this group, doing a variety of different things. So a challenge for the groups, the girls very much wanted to continue meeting, but the girls who had been through the SRH curriculum essentially were going to go through it again, but you can only do that so many times. The economic empowerment component had this kind of more sustainable piece because you just save, and saving has its own logic, and economic gains are particularly powerful motivator. But What has happened, I think, is that CARE has been adapting its programming and doing quite a bit with them. But on top of that, we've seen some quite compelling evidence of just this becoming its own self-sustaining model. So ODI did a review of child marriage programs in Ethiopia and went into the communities where these programs had worked and did qualitative work with beneficiaries. And TESFA was one of the places that they visited. And their conclusion was it was the most impactful long-term program of the lot that they looked at. And what we're seeing is girls are breaking off and forming more and more and more of these groups. And the community framework is now there to support that. And CARE, of course, is there helping to manage that process. But it's an interesting question. You know, the viability of peer education models is something that is very much questioned at the moment. In this case, it absolutely worked for most things that we were looking at. The question then is, how would you scale this model? And I personally don't think that the scalability challenges are as large as we're making them out to be. But we haven't done it yet, so we don't know. And nobody's funding scaling of the TESFA project right now. So we won't know. But I think I caution the push to dismiss peer education models. I think it all depends how you do them and what the engagement has to be.
So can I just add two things? One, to what you just said. So as long as we're dreaming about scaling the TESFA model, can we also dream about synchronizing it and working with men and boys and girls at the same time?
Yep. Yeah. No, I think if I could go back and redo it, and obviously CARE are the implementing partners, and they would have to do that. But I think we all very much, that was one of the key lessons we learned, and it was very much, you know, this was seeing whether it would work. It worked. Now what is the next question? And I think it's just been a little bit of a challenge in the absence of sort of publishing peer-reviewed pieces showing that it worked. So who knows? I'm hopeful. I mean, it's certainly, I've been at IGWG 10 years. I've worked on a lot of great projects, and this is just by far my favorite. I love this piece of work.
So if I could just address something else that I think a couple of you have said. So all last year, the IGWG GBV task force looked at experience of violence across the life cycle and impacts during adulthood. And so it's on the IGWG website, and there were a lot of great presentations, starting with a long piece, the first session that showed the implications and the impact across adulthood. So I would say go back and see if we can do that again, and maybe next year somehow link it to child marriage and education and peer education and all of that. So did we have any other questions in the room? Oh, we do. Okay, hold on.
Can I just jump in? I work for CARE, and Jeff doesn't know me because I'm relatively new to CARE, and we have a lot of questions, so I don't want to take a lot of time. But just to say that the TESFA model, or at least pieces of it, are going to be a part of the GAGE research project, which will be led by ODI, and it's a very exciting longitudinal project, which is going to be hopefully funded, the implementation piece, by Gates. And so I just came back from a workshop last week thinking about what pieces can we take from TESFA in this cross-country program and research platform that's looking at outcomes for adolescent girls across a range of capability areas. And it will be a synchronized program working with boys, girls, parents, and communities. So I think it's going to be a long time before we see the outcomes of that research, but to the extent possible, I'm sure that CARE and the other partners in this consortium, where Pathfinder, Save the Children, World Vision, ODI, and some others, will want to keep this group informed. Oh, sorry, I'm Hillary Matthews with CARE.
And just to say that the SAA model that was used in this is being used, I think, very widely in Ethiopia. It wasn't unique to this project to begin with, but I think this perhaps was one of those first really, wow, this really worked so well. Let's do it everywhere in one variant or another. And so that level of sort of community engagement and buy-in through a slightly different mechanism has been, I think, very effective.
So hi, my name is Christine Sason. I'm with Banyan Global. First, thank you so much for this very interesting and a lot of rich data and analysis that was presented. But I wanted to see if I might pivot the conversation a little bit more towards the advocacy aspect of what is, the what then component that comes after all of the research. And your thoughts on strategic entry points for advocacy around this data, and more specifically, thoughts on where you see an opportunity to incorporate or couple an economic impact analysis to advocacy work. And the reason why I ask this is that at Banyan Global with ICRW, we're leading a research project on looking at the socioeconomic impact of including child marriage and other forms of GBV across the Middle East and North Africa region. And we're finding that there's relatively little work, precisely because it is fairly challenging, relatively little work and advocacy that incorporates an economic impact argument. So I wanted to see if you had any thoughts in terms of how that data, if there are trends necessarily to collect this data, and then where you see, again, strategic entry points for the advocacy component with that data.
I'll start and then pass it on. I think it's interesting you bring this up. I was also going to bring it up. ICRW, in partnership with the World Bank, right now is working on this economic impacts of child marriage project, which is it's conducted in 2 phases. One is very much at the kind of macro level, looking at using DHS data to dive into countries and try to tease out first what are the impacts in certain areas, and then what are the economic implications of that. So for example, one very clear impact, which is not a surprise to really anybody, is on fertility. So the earlier you marry, the more likely you are to have kids. The more kids you have, that has, at a country level, a very significant effect. I would say that it's just very complex to tease those factors out, and a lot of what we're talking about is not easily monetized in terms of impact. And so some of those easy ones, sure. You can look at education, you might be able to look at labor force participation rates, those kind of things. But what we're finding is it depends where you are. So, for example, one of the countries we're really focusing in on is Niger. In Niger, child marriage has very little effect on labor force participation. Why is that? Because everyone does the same things throughout most of Niger. And so it's not like if you don't marry, you're going to be working in a bank. So the impact is just different. In a place like parts of, say, like Uganda, or a place where where we would think the opportunity cost of child marriage was particularly high is in places where there are other opportunities that you are foregoing or being denied by being married early. So it's not a straightforward exercise, but the results of that should be coming of the initial phase with country reports for 3 specific countries, and then a series of broader multi-country studies coming out by June, July for sure. Well, I won't say for sure. Hopefully.
Sometime this summer.
Yes, but that will include a look at a lot of different pieces along the causal pathway in terms of impacts, and then a bigger picture kind of what does this mean in terms of economic costs. And a lot of it depends on what's the prevalence of child marriage in your country, what proportion of, say, early childbirths are due to child marriage, because you can have a lot of maternal mortality, for example, but that happens, it might be particularly bad for adolescent girls, but it's bad for everyone in a country like Niger. So the economic impacts of child marriage specifically probably look small, although in practice the sort of lived experience is quite large, but at the national level, when you're just looking at dollar figures, it isn't as impactful as other areas. But I will, as a teaser, I mean, some of you have already seen teasers of this a couple times. The impacts are pretty enormous in terms of dollar figures when we're able to estimate that. So God willing, there will be results coming out sometime soon.
I think, just to clarify, are we asking particularly about the economic cost of child marriage or sexual violence? Because I think there's data on the latter for sure, right? Because it connects more directly to morbidity and mortality and loss of productive time and reproductive impact and stuff. So just, yeah.
Sure. So
yeah.
Our work is focusing a little bit more on the direct rather than the indirect costs of violence. And on IPV, yes, we're able to find a lot more information, but when it comes to child early and forced marriage, we're also looking at public and workplace sexual harassment. There's relatively little data that we've been able to find in terms of certainly direct economic impacts of those two forms of GBV.
Yeah, I don't think that, I think Jeff has answered that well. I don't think that data exists. And, you know, I think the point about the differential and what the economic opportunities are and both the prevalence of child marriage is an important distinction to keep in mind.
And the thing is that quite often we're talking about two separate research cultures coming together, right? So economic growth modeling, economic impacts, and our more familiar kind of health areas. So the issue is partly that the DHS is focused rightly on demographic outcomes, much less so on the kind of detailed, nuanced, say, labor force participation outcomes that would help us tease out some of, say, the income effects. Whereas the LSMS, which is what the bank and others use to calculate labor force participation rates and those more nuanced questions, typically doesn't ask age at first marriage. Some of them do, which means that as a practical, it's just very difficult to tease and to put those things together. We tried to combine those in the economic impact surveys, and the economic component didn't work very well in our questionnaire for reasons unknown.
So I'm going to answer a slightly different question, and I hope you bear with me, but it has to do with the advocacy question that you asked. One problem in the field is that we all have our sort of pet area that we like to look at. You know, is it child marriage? And we quantify the importance of that in many different ways. But we don't often look at the relative importance of different social factors. And someone mentioned that to me a year ago, and I said, that can't be true. And I did a search of the literature. And yes, that is in fact true. Very rarely do people do sort of relative comparisons. And that's exactly what we need in order to make some of these policy determinations. We know a bunch of things that are very important, but which one is more important? And more important in that specific country context, because as Jeff mentioned, in contexts, where child marriage is low, that's not necessarily where we're going to focus or where it has less of an impact. So I think that's a very relevant question, and I actually was part of a larger Gates project looking at the influence of gender-based policies on health of women and children. And my piece of it was looking at the social determinants of health. And we looked at about 16 or 17 different determinants, everything from employment to the decision on how to spend that money in the household, to educational factors, to intimate partner violence, to access to family planning or clinic care, many, many different things where women tend to be disadvantaged and which we believe should, there's good evidence that it impacts their health and the health of their children. And our question was really, if we're going to prioritize action, where do we start? And what we found in almost every case, and we ran analysis lots of different ways, I won't bore you, but was that education, particularly secondary education, and child marriage were the two variables that popped, that were robustly associated with most, particularly maternal health outcomes. So child marriage and education were robust predictors. They were at the top of the list for things like intimate partner violence and adolescent fertility. Child marriage was a little less important than some other predictors for child outcomes. And I will get around to submitting that for publication very soon, I promise. Gates has the report, and it's on my desk. And we go a little bit further in that paper, and we say, okay, well, here's the average. We used about 100 surveys from the DHS, and here's the average levels of things like child marriage or education in that data set. If we bump them up 10%, what would be the impact on these outcomes? And the SDGs calls for universal education, universal, bans on child marriage. So if we actually had universal access to secondary school, if we actually eliminated child marriage, what would be the effect on different things? And we include IPV in that. We include adolescent fertility and a few others. And they seem like huge odds ratios and really important. And then at the end of the day, some of them, like secondary education, can move some of the outcomes quite significantly, maybe 10 percentage points. Others, it's only 3 or 4 percentage points because, again, only a small proportion of women are actually still getting married in certain countries. And that's a global analysis, and I think it would have to be repeated country to country to figure out where you want to prioritize your focus. Because, again, it's a distribution of these determinants. Is it child marriage that's really prevalent, but also is child marriage in that context really problematic, or is it education that's the barrier, or economic equality, or communication? We include communication with the spouse in this analysis. So this is just a broad starting point, but it's another way of prioritizing action. It doesn't get to the economic side of it, and that's a limitation.
I'm going to give, did you have another?
No, I think maybe you're thinking along this way, but I think the issue is that a lot of and Rose mentioned this earlier, if I'm looking at unintended pregnancy, a lot of the global health outcomes that we're interested in have similar social and structural determinants. And so, yes, sometimes they vary a little bit, but some of the gender norms, some of the interpersonal relationship characteristics, some of the economic circumstances are sort of consistently influence a lot of the global health outcomes. So I think if you keep the broader social determinants framework in mind, you can help prioritize where the advocacy needs to be done, or what are the things that need to be prioritized. Sorry.
No, it's okay. We actually won't get kicked out of this room until noon, but I wanted to give Michal the last question here, and then hopefully you guys won't run off. Did you say? Yeah.
Thank you. I'm still really fixated on this issue of policy. And what's playing around in my head is several years ago, I've lost track of time, I don't know, 4 years ago, I happened to had the opportunity to be at the Commission on the Status of Women, actually sit in that room where every country comes up to the panel and has their 5 minutes. And I can't tell you how many countries, one after the other, just, patted themselves on the back for the various policies that they have passed on GBV, a range of GBV-related policies. And, I just can't help but sort of think, what is it that we need to be doing policy-wise? And I completely understand there's the interpersonal elements. But first of all, I think there's this notion that we've dealt with this issue because X country has passed a law. So it kind of combines the advocacy question. What is it that we as a community of practice need to, and researchers need to bring to the public's awareness about the passage of laws and the fact that they're not contributing to change. And then the other piece, I would love to hear from you as researchers. What do you think are the policy and advocacy, is there research or action that's most needed in that realm from your perspective? What is that? Besides, I think one of you had said it's so important to understand from girls' perspectives what they know about existing laws. Beyond that, what do you think?
Yeah, we go in order.
So I think from a policy perspective, one lesson I take away is that we're looking way too narrowly. When they talk about policies for gender-based violence or child marriage, they're talking about, policies that name those things that are very specific to the age of marriage or gender-based violence. But these have upstream determinants. And I think, honestly, if we got all girls through secondary school, we would improve pretty much every outcome any of us work on. And so when we're talking about policies for things like child marriage, it's not just the minimum age. And part of looking at that was not just to say we have to do it better. And I do think we have to do it better. And we have to monitor implementation, enforcement, and potential harms, absolutely potential harms. But I think we also need to look at the potential of other kinds of policy for these outcomes. So that's probably, one piece I would say is both enforcement and implementation, how they are really using policy, not just in a criminal way, but to change gender norms, because I do think it can do that very subtly and slowly, but it can play a piece. But then also looking at other mechanisms that can achieve those goals, but by working through other social determinants.
I think maybe there's a more philosophical response to your policy question. I think just the way we think about sort of norms not being static and changing, I think we actually have to start thinking about policy as something that changes, and particularly true in this current environment, both in this country and globally. There seems to be a rollback of sort of some of the laws and policies that have been enacted for domestic violence, right? So I think the next step for us as a community of practice and researchers is really to think about policies and the key influencers and how they shift and adjust both in their application, both in their sort of their setup, how they're introduced, and in their application. Because those have varying effects on both men and women who are affected by these policies. There is some great ethnographic work that has looked at when some of the consent laws have been very sort of specifically implemented and have punitive damages associated with it, and who is really the one who's being affected, not the old man who's marrying the 14-year-old, but the young guy who can't pay bride price and things like that, right? So I think, one, there is some work, I think there's more, but I think we have to start thinking about policies in their fluctuations with changing administrations or changing key leaders, right? What happens in Kenya, just to take the example of that person who was advocating PrEP leaves, maybe it'll fall off, right? Tanzania, there's been all this shift in terms of their HIV programs because of what the ministry is prioritizing. They outlawed lube, then they said now private facilities can't provide HIV services. There's so the policies themselves are not static, and they change and their implementation changes. So I think that may be the next area of work to think about.
I think I very much echo Rachel's point on we need to think broadly about where the bigger impact is going to be and what governments can feasibly shift. Gender norms, I think governments are going to have a tough time doing that through policy. So we can probably imagine effective policy shifts that would have an effect on gender norms. But are they already existing? Are there things that we could build on? I think the emphasis on secondary education is one that would be easier because it's already part of our development goal structure. We know that it's protective in various different ways, and we know now that that seems to be where the drop-off is for girls in particular. And so there's a lot of challenges in that for obvious reasons, otherwise we'd be there already. But I think that would be one area that I would think would be a useful way of tackling the child marriage issues and violence issues potentially through something that doesn't have to say child marriage or violence in its title. But if we're going to do that, we need to think about where in that process does this protective effect come in. Is it just that parents are like, oh, well, they're in school, so we won't marry them? Or is it that parents see a value in the education, and that is a justification for keeping girls in school? I think it tends to be the latter. If parents can see a payoff, not just in economic terms, but if they can see the benefits of schooling their daughters, they will. The problem is when you're in situations where that payoff isn't clear, or in part. I mean, that's part of the issue. I think quality of schooling, linking girls to to actual live jobs at the end of schooling so that there's a reason to be schooled. And I think safety in schools, let's not forget that parents rightly in many cases fear for their daughter's safety sending them to school, both because of where they have to travel to school and what happens in the school setting. Mm-hmm. And if we don't tackle that, then we're not responding to a very legitimate concern. I mean, if I had a teenage daughter who had to walk for an hour and a half through areas where she was going to be sexually harassed, and then at school would have sexual harassment from teachers and other students, I would think very carefully about whether that was worth it. Particularly given that in a lot of places the sort of range of options for a girl who is raped immediately becomes, so narrow. So it's not an illogical calculation that parents are making at all. And I think we also need to explicitly know that in our programming. I, of course, think that doing, comprehensive sex education would be fantastic because it involves gender transformative thinking when it's done in a comprehensive way, and it starts early. And I think that you can do that through the school system. You can do that through government structures, but you need that level of buy-in. So if I had to pick two, those would be probably the two I would pick right away. And again, I think the key interesting thing about that, neither of them are specific to child marriage or to IPV, but I think would have enormous effects on them if it was done right.
Can I just add one postscript? I agree with everything that you all just said. I would just say that just as in the data and the action gaps about moving beyond prevention of child marriage, I think the policy advocacy ends often with preventing child marriage. And I think there are several policy actions and policy that can be enacted that addresses the child bride. And I think that I alluded earlier to schools that don't automatically cut off girls who are married or who have children, which has been done very effectively in Jamaica, for example. So that as we think about the policy arena and the actions that are necessary, I think that that's an area that has not been thought about enough. Safe spaces for married girls to congregate or, things like that. So, but thank you all very much. And thank you to our audience who participated beyond my wildest dreams and stayed beyond all of those hours that we've asked of you. And we will upload all of your materials, your links, your PowerPoints, and please join the IGWG listserv if you're not already on it. Thanks very much. Thank you.
So I'm going to have to bail on lunch, unfortunately, because I have a proposal that I have to finish.